Hi, thank you for your interest in the Patient Care Tech program through St. Charles Community College in partnership with BJC Healthcare. My name is Jenny Fuentes. I'm the Health Occupation Coordinator here at the college. And today we want to talk to you a little bit about the Patient Care Tech, otherwise known as the PCT program. The first question that comes to mind is, what exactly is a PCT, or a Patient Care Tech? And really, it is an assistive role to nursing that typically is employed in acute healthcare setting, such as a hospital. What does a PCT do? So some of the skill sets included in this course and the role of a PCT are really defined in the name itself. It's patient care. So everything from their basic needs, that's where everything starts. So you're helping patients with their bathing and ambulating, using the restroom, taking their vital signs, and we get a little more advanced, be able to perform an EKG or draw blood, phlebotomy. Those are the skills that you will learn in the Patient Care Tech program. The value of this program, it's a very unique partnership and unique opportunity for students to become gainfully employed while they are finishing their education as a patient care tech, while being employed by BJC Healthcare. So while some people, that is not something they're able to do, is take time off to go complete education and take that time off work. So you are gainfully employed through this program and paid for your clinical hours. So, and we'll go into that more in depth later. I want to give a little overview of what the coursework looks like. So it is a 7-week course. The course content consists of reading a textbook, completing assignments in a workbook. There are PowerPoints to guide you, and then a weekly exam. The majority of the content is online based. You are not live time Zooming with an instructor. You are able to complete the content at your own pace at times that are convenient for you. However, you do have to meet certain benchmarks. So all of week 1 content has to be completed by the end of week 1. You are able to work ahead, but you're not able to fall behind. So that's something to note. It is a very short and fast-paced program. Keep that in mind. So every week has your course content. And then on top of that, you alternate between either coming to the college for a hands-on lab. So you will come to the college, you will practice those skills that you have already read about and seen videos about. You will practice those live time with an instructor and a mannequin to build your competency. And on the weeks that you're not in lab, then you will be going to 3 12-hour shifts at the hospital to demonstrate those skills live time with patients. So every week is coursework, reading, an exam, and then you will alternate between the first week you'll have a lab, the second week you'll go do 3 days of clinical. The next week you'll have a lab, the next week 3 days of clinical. On the 7th week, it is strictly clinical. So that's kind of what the coursework looks like. The commitment for the program, I did mention that it is fast-paced. That is a lot of information to cover in such a short amount of time. With that being said, it is a time to ask yourself if you can make that commitment. If you are not able to dedicate 6 to 10 hours of studying, preparing, reading each week, then the time may not be right for you. There is not a chance for you to fall behind and catch back up. Attendance is also very necessary. So missing a day puts you behind. There's not a lot of time built in to work around absences. So if you have a planned extensive absence, vacation, surgical procedure, something of that nature, this might not be the time to start this cohort. Maybe a future cohort is for you. As far as the process begins with BJC Healthcare applying, and they'll go into that later, but you'll apply and become employed there. And then the second part of the process is to come to the college, and we will have you apply to the college and register for the actual course. So that is a very generalized overview. From here, I would like to introduce Diane Lake, who will be speaking to you from BJC Healthcare.
Hello, my name is Diane Lake. I am a senior talent advisor with BJC Healthcare. I am going to be your HR representative that will help you through the application process, the interview process, and the hiring process. I wanted to share our BJC values with you. BJC prides ourselves on taking top-notch care of all of our employees. So here are our BJC values. This is what we expect out of all of our caregivers who provide care to our patients and their families. First, we expect our patient care techs to be compassionate, caring, and want to do the right thing for our patients. Need to show respect to all folks that are in their care, provide excellence, and then be safe while we're doing this. You will learn tricks of the trade to make sure that you are safe for yourself and our patients, learning to lift them and transport them. So safety is very important. Next, we do work as a big team. There's 31,000 caregivers within BJC Healthcare, and we work as a team together. So those are our values and our expectations to join BJC. Next, I'd like to discuss our hiring requirements. For the PCT position, you must have a high school diploma or a GED, which would be able to be verified. Next, you will need to complete an interview process. You would first start interviewing with myself, doing an HR interview, and then moving on to the hiring leaders if that seems to be a good fit for everybody. Next, we do have a reference request to do, and you will do skill survey. We are looking for at least one leader and one coworker who can speak to your behalf about your work ethics, your skill set, those kind of things. And at this time, we are requiring that all of our caregivers are fully vaccinated with the COVID vaccine, at least having 2 of the Pfizer or Moderna shots or 1 of the Johnson & Johnson, and that is required to start at BJC. And we also are all required to have an annual flu shot. We usually get these in October. The only exceptions to these rules could be a medical exemption or a religious exemption. Next, I'd like to talk about after you have gone through the process and if an offer is extended to you, it usually takes approximately 10 working days to get through our next requirements. We ask that everybody complete an occupational health visit. We will do a drug screening, a urinalysis where they do test for illegal drugs. Next, we do a thorough background check. They will verify, as I mentioned before, your high school diploma or GED or higher education and check for any criminal history. The next step would be to continue with BJC after the cohort. You will need to pass the PCT certification test. We do require that you stay with BJC and remain in good standing for at least a year in order to be eligible to transfer to any other positions within BJC Healthcare. We look forward to having you as part of our PCT cohort and thank you for your interest. I'd like to pass things on to Beth Camp, who is with our build team. Thank you.
Thank you, Diane. We are really excited about the possibility of you joining BJC's team as a patient care tech. This is a valuable position at BJC, and as has been mentioned previously, BJC cares so much about bringing the right people into the role that we hire you into the role, pay you while you go through training, and cover your tuition with the use of our tuition assistance benefit. This is an amazing benefit that really differentiates us from many of the other employers in the St. Louis area. Every full-time employee at BJC is eligible for up to $4,500 a year of tuition assistance benefit, and that can cover additional training programs, getting a college degree, going to nursing school. There are just so many possibilities. But for this program, we start with covering the cost of your PCT program. And further, if you advance in this process, we will go over all the details of what is involved with the cost of that tuition. But most PCTs who join BJC through this process have their tuition covered. They work for BJC for 12 months after their graduation date, and that completely repays their work commitment to BJC. And if they leave the organization, nothing is owed back to us. Now, if you do leave BJC before that 12-month period, you will be expected to repay the tuition. So we really want to make sure you know that up front and that you consider that, but that you consider it not just for this role. BJC is a great place to grow a career. And as I mentioned, there are other training programs available. There is the use of the tuition benefit to go back to school, and you can have a very meaningful and long career in healthcare at BJC. And we really hope that this is your first step towards fulfilling that. Happy to talk with you more about that as you advance in the process. And now I'm going to hand it over to Sierra Bex with Barnes St. Peter's.
Hello, thank you so much, Beth, Diane, and Jenny for speaking on all of that. As Beth said, my name is Sierra Bax. I am the PCT program coordinator covering Barnes Jewish St. Peter's Hospital as well as Progress West Hospital. I've been with BJC since 2013. I started as a patient care tech myself. I decided to continue my education and become a nurse, where I worked kidney and liver transplant for several years before I transferred to IV therapy. I completed my master's degree actually with the help of BJC's tuition reimbursement, and eventually I moved to education, which is where I work now. I do just want to mention that while I chose the path of nursing for myself, the great thing about this program that Beth alluded to is that it's a foot in the door to BJC, where you'll be exposed to so many different aspects of healthcare. And this program is a great way to get that exposure to all the different paths that you can take and decide which one you may want to take for yourself. Whether you become interested in nursing, respiratory therapy, physical therapy, radiology, you name it, you'll have access to the support and the benefits that BJC offers to help get you to that goal. I'm going to show you what you can expect for the program schedule if you end up working at either Barnes St. Peter's or Progress West. We also have Liz Smith on the line, and she'll be able to show you what the schedule would look like if you end up being hired for Barnes Jewish West County. So real quick, I will share my screen here. And so this is a template of the schedule. This is what you can expect. There is a little bit of flexibility when it comes to the clinical shifts that would be communicated to you throughout the hiring process as far as what your schedule would look like. But as Jenny spoke to at the beginning, week one, the very first day of the cohort is going to be our new employee orientation. So that's going to take place at your home hospital. For either St. Peter's or Progress, we do our new employee orientation day one at St. Peter's, and West County employees would go to West County during that day. We have a full day lab on Tuesday of week one as well. That covers a lot of different items like safe patient handling and code blue response, lab, infection prevention, items like that. As Jenny mentioned, you'll have a lab day at the college. That starts on week one. That's where you'll practice what you're kind of reviewing in your online class and get a little bit of confidence with that skill before you head to the hospital. Friday during week one is usually when we have you complete your EPIC training, which is our computer charting system. Week two, you'll start your clinicals. Here we have Monday, Tuesday, Thursday clinical shifts. Often that's what we go with. But there is, like I said, a little bit of flexibility in that. But it is going to be important that during weeks 2, 4, 6, and 7, you're able to commit to 3 12-hour shifts. So as you can see, week 2, you have your clinical shifts. Week 3, there's no clinical shifts, but you'll be doing your online coursework with your lab day that week. Week 4, back in clinical. So you can see how it kind of alternates week to week. For St. Peter's in Progress, we added in a BLS class. Usually that takes place on the Friday of week 5, and that's for you to get your CPR certification. And week 6 and 7 are back-to-back clinical weeks. If you're hired for night shift, that you will flip to nights at that time to help get you used to that schedule. If you're hired for day shift, a lot of times we'll keep you on days. for that. So that's kind of an overview of what you can expect for the schedule for the 7-week program. As Jenny mentioned, it's incredibly important that you're able to commit to that schedule. There's not a lot of time built in for any sort of makeups. We do understand that things come up sometimes and we do our best to work around them. But if you know in advance that you're going to have conflicts, that's going to be important for you to communicate to Diane so we can see if it's something that we can work past or if maybe a future cohort is going to be a better fit for you. So with that, I'm going to just say that I'm really excited that you're interested in this really unique program. I think it invests in you really well from the start, and we'll be here to kind of help you along the way to reach your goals. And now I'd like to introduce Liz Smith from Barnes-Jewish West County.
Thank you, Sierra. I just want to introduce myself. My name is Liz Smith, and I am the PCT program coordinator for Barnes-Jewish West County Hospital. I completely concur with everything that everyone has told you so far. Just a little note about myself. I actually came from an outside organization and became part of BJC since 2020, and I made the right decision. I'm actually starting my master's program later this year just because they have such great opportunities. You just can't pass them up. Having said that, I am going to go ahead and share my template for the 7-week training schedule that you will experience here at West County. It's going to mirror a lot of what Sierra already showed you in regards to Barnes St. Peter's and Progress West with a little bit of variations. So that first week is pretty class heavy at the hospital and at the college, obviously. That first day, you're going to go through new employee orientation. You will also meet your managers at lunchtime so that you can put a name to the face and sit with them and chat with them for a little bit. And then that afternoon, you will actually start logging into our our online learning system, which we call Saba. So you can get used to that procedure. So, and then on Tuesday, again, you're going to be doing some clinical skills. You'll be learning how to use our glucometers, which is how we measure our patients' blood sugars. You'll be learning safe patient handling, where you'll get to actually practice with equipment that we use in real time, transferring our patients, along with a few other presentations. And then that Friday, that morning, you'll come in and you'll work on your CPR certification. So that's your BLS online modules, and then actually utilizing those skills that you learn and getting certified through our heart code system, which you will learn about. And that afternoon, you will be in EPIC training. That second week, you will be on your clinical shifts on the units. That first day is where the manager will spend a few hours going over things like policies and procedures, such as professional appearance, attendance requirements, things like that. And then if you still need to check off on your BLS, you will do that in the afternoon. And then week 3 is at the college. Week 4, you'll continue your clinical shifts with your preceptors. During that week, you'll also attend phlebotomy training, which is how where you'll learn how you're going to draw lab specimens for your patients, and you'll also be attending therapy class. And then weeks 6 and 7, just like Sierra says, same for West County. If you are hired for night shift, that's when you will flip to night shift, because it is a different flow from day shift. So just something to note is that you might need to be a little bit flexible. You might be with different preceptors during this program, but we try to make sure it's as consistent as possible in order for you to be successful during this program. And thank you so much. And I'm going to turn this over back to Diane.
We hope that you're excited about the PCT program for St. Charles Community Hospital. As we've discussed, we are looking to hire for 3 hospitals: Barnes Jewish West County, Barnes Jewish St. Peter's, and Progress West Hospital. We do have day shifts and night shifts. PCTs work 12-hour shifts 3 times a week. That is considered full-time with BJC, 36 hours a week. We do require weekend rotations and holiday rotations for these positions as well. Please take a few minutes and go on to our website. You can log on to www.bjc.org/jobs, put in PCT cohort, and select which location works best for you. Thank you for your time this afternoon, and we look forward to talking to you soon. Have a great day.